Welcome to another episode dedicated to enhancing your musculoskeletal health. Today, we have the privilege of hosting Dr. Allan Mishra, a renowned Stanford Orthopedic Surgeon and the visionary behind Vitality Explorers, a movement dedicated to researching and sharing ways to enhance longevity and performance. Dr. Mishra has significantly impacted the field of regenerative medicine, notably through his landmark research on platelet-rich plasma for chronic tennis elbow. He's also the author of Dare to be Vital, a compelling guide to achieving vibrant life. In this episode, Dr. Mishra will share 3 specific strategies to boost your vitality and performance, empowering you to lead a more active and fulfilling life.
Yeah, thank you
Welcome,
so
Dr.
much.
Mishra.
Thank you so much for having me. That's a very kind introduction, and I'm looking forward to, shall we say, vital and vibrant discussion.
Let's do it. So, Dr. Mishra, can you start by letting everybody know they hear orthopedic surgeon and they hear somebody that's talking about vitality and somebody is talking about longevity, and you might think, where does that come from? Because don't orthopedic surgeons just like to cut bones? So, kind of tell me where this came from.
Well, Tammy, you talked a little bit about my PRP research, and I'm very lucky to have been invited to a lot of different places all over the world because of those papers that I published on the use of PRP for tendinopathy and some of the basic science papers about knee arthritis and other ones. And so the true interesting story, which kind of ties it all together here, is I was invited, I can't believe it's been about probably either 7 or 8 years ago now, to give a talk in Hong Kong at the Chinese university there. And it was in the middle of July. It actually happened to be on my birthday, which is July 8th. And I'm thinking, okay, that's a great thing to do. I've never been to Hong Kong. I would love to go to this invite. And then I realized it's like 99 degrees and 120% humidity in Hong Kong in July. And I was trying to get my family to go with me. And they're like, oh no, I'm not going to Hong Kong in July. So it's not exactly close, but we had always wanted to go to Australia. And so prior to that meeting that I went to in Hong Kong, we went on a 2-week trip to Australia. We saw Sydney and went to Uluru, which is used to be known as Ayers Rock in the middle of the country. And then we finished in a place called Port Douglas, which is adjacent to the Great Barrier Reef. One of my big checkbox bucket lists, whatever you want to say, was to go scuba diving in the Great Barrier Reef. And so I did that. And again, we're staying on this beach. It's sort of northeastern Australia. It's literally called the 4 Mile Beach. And I would run up and down this beach, go about 2 miles down the beach, take a little swim out into the Coral Sea, and then 2-mile run back. And the last day I was there, again, I'd been on vacation. My phone didn't work. I was feeling pretty relaxed, but I'm standing underneath this almost 80-foot tall palm tree, looking at the Coral Sea, which is really just this unbelievably blue body of water. And then I had sort of this inception moment for anybody who watched that movie by Leonardo DiCaprio. It's like somebody implanted this little idea in my head that said, I felt really vital. And I'm like, I want to feel this way for as much of the time as I possibly can. So that's sort of the origin of where I came up with starting to work on vitality. But it's tied to the PRP because on that beach, because I know so much about blood and bone marrow and growth factors, I thought, okay, I'm going to come up with a biomarker for vitality. So that's sort of the beginning of the story. Again, that pulls it together with the PRP research.
I love that origin, and I love Port Douglas. I've been, and it's absolutely a must see. So, wow. Okay, thanks for the background on that. Tell me how you are going to give these 3 specific strategies and how that relates specifically to, the musculoskeletal health, because that's who mostly the listeners are. But muscle is motion, muscle is medicine, lotion is motion, all the things that you talk about in Vitality Explorers. So bring that around.
Well, it's kind of an interesting thing because a couple of years ago, I had to kind of solve this equation because I've been working on vitality and what that means for, as I said, 7 or 8 years now. I've taught a course through Stanford Continuing Studies, and it's all been on nights and weekends. And I thought this was just this personal journey that I've been on. But I think it was about 2 years ago, Tammy, I realized that as an orthopedic surgeon, I took a lot of trauma call for a long time, but I don't do that anymore. I might have saved somebody's limbs and occasionally saved somebody's life. But for the most part, what I do or what I've done for decades now is to enhance people's vitality. That's what you do by trying to take away their pain, to try to help them with their situation, is we're trying to get them back to what they love to do. So when I saw this equation, I said, wow, I'm not really doing anything different by what I do with what I call my day job. I'm trying to enhance people's vitality. And then these two started to merge about 2 years ago. And maybe it's 3 years ago now, because I think it's 3 years ago, because it's starting to get a little fuzzy in time. But I started realizing I see a lot of people with knee pain. I see a lot of people with knee arthritis. And as an orthopedic surgeon, kind of ashamed to admit that I didn't really want to talk about it because it's very difficult. But as I was doing my work on vitality, it became very, very clear that weight matters and that your challenges with being overweight actually are so much more important than whatever formulation of PRP or whatever surgery you're going to do. And so I'm very lucky to work in a multi-specialty clinic. I have a lot of people around me who can help me. But instead of running away from it, I ran right towards it. Okay. And I decided to literally tackle the elephant in the room. And so if somebody came in with knee pain, specifically knee arthritis, I put it on my checklist to talk about every single patient. I did that in the context of having a nutritionist that I work with, having lots of primary care doctors and other people who are experts on that. But I put up a sign in my office, and the sign in my office basically is the biomechanics of hip and knee pain, which is somewhere between 4 to 6 times your body weight goes through your knee or your hip when you take a step, or especially if you go up and down stairs. So if you kind of round that to 5 times your body weight, you come up with this line that I had 2 lines. The first line, again, I'm sharing some of my secrets with you here, but feel free to steal this one. It said, do you want to be treated well, or do you want to be treated optimally? Now, they would typically tilt their head, and like when you say treat to a golden retriever or a squirrel or something, or they would be like, what did he say? I want to be treated optimally. And what I did is I said, I say every day, I will always treat you well. That is my job. But in order to treat you optimally, you and I need to become partners, equal partners. A partnership means a partnership, not me giving everything and you not doing what I ask you to do. So when they say that, it opened the door, and I said, okay, we have to talk about something here. And I would say, can you lose 5 pounds in the next 2 months? And I said, here's some resources, here's some other things. Yeah, I can lose 5 pounds. Well, if you lose 5 pounds, your knee is going to feel like you lost 25 pounds. You see the sign over here? And so they go, oh, I've lost 5 pounds before. Okay, well, we're going to work on keeping the 5 pounds off and then working towards more. So I started with the weight. And the true story was I was petrified, because I don't know if you have this, but we all have people who like to rate us, right? It's like rate your professor, but it's rate your doctor. And I kind of decided that I wasn't going to be ashamed about literally attacking that very important problem. And I said, if my ratings go down, or if I don't have anybody to see, then I'm sorry, but I just have to do what I think is right for the patient. And that is attacking that. And the opposite happened. I went way up. I already had very good ratings. I went through the roof to the point where I have plenty of patients to see. But I think what came back, some of the comments was, he actually really understands that I need to do this, and he inspired me to do this. And so over the last 2 to 3 years, now I have hundreds, maybe even a few thousand people that I've taken through this beginning. That's what it started with, weight. And then as I started to bring in some of these other parameters, and sleep and inflammation, all the stuff I've been doing for myself, I've seen what can be done in what we like to do with, I want to call it vitality medicine, but that's kind of what it is. It's not lifestyle it's above that. It's like trying to lead your most vital life requires you to take ownership over your decisions. It's not something you can give your patients, or they can get from their mom or their dad or their government. It's something they will earn by making better decisions about how to use, decisions about what they eat, how they exercise, and how much, wait for it, responsibility they take for their own outcome. So this is something that's been at it for 3 years. As you know, it's morphed into a whole bunch of other things, but the two have come back together in, I think, a very important and synergistic way.
Vitality medicine it is. I absolutely practice this, and I love that you have brought it together with that. It must have been really scary, but like you said, it is worth it to be dedicated to the outcomes of your patient, which you know is going to go decades beyond your engagement with them, decades beyond, and can improve the quality of their life. So thank you for doing that.
Well, it's actually helpful for you and I, Tammy, and I don't mean to be selfish about this, but here's something for maybe any doctors or providers that are maybe listening to this is, if we do the best we can for our patients, in whether it's a surgery or an injection or just even outlining a treatment protocol, and the patient doesn't do what they're supposed to do or says they will, but then doesn't do it, here's what I started giving myself is a little grace to say, if they came back and they didn't do what they were supposed to do, whatever their outcome was, if they weren't where they needed to be, it wasn't entirely my fault. Now, the opposite's also true. If they do what they're supposed to do and they tackle the difficult problems and they are consistent, what I joke about is like, okay, you lost 5 pounds, you're sleeping better, you're exercising more, you're trying to reduce the stress in your life, and guess what? You're a lot better. You should charge your insurance company because you did the hard work and you get the credit. And by the way, this is empowering. So for the patients who are listening to this or the providers, if you empower your patients to help themselves, it's sustainable. If you decide to be the person who's in charge all the time, I don't think of myself in charge. Again, it's a partnership. If it's 50-50, it's 50-50. I'll do my best. But if you don't do yours, then you're not going to get the credit and you're going to get the blame if you don't. And it's a hard thing to do, but I'm really lucky to be trying to help other doctors and future doctors learn this way of trying to create a true partnership, because unfortunately the patient is not always right. The doctor is not always right. And we need to work together towards the best solutions for our patients.
Absolutely. The partnership is it. And you've got some help. You practice in a really neat and unique environment. For those physicians and other teammates of the healthcare profession that we work with, how do you set up something like that if you've got, say, it's not that you can bring them in under your roof and have a holistic healing center, which is my dream, but it can be where even you're partnering with somebody else in the community. How do you suggest they set that up?
So I actually am doing it on my own. I don't have a big team or a big group of people. I think it's possible that could be evolving over time, but I think it's just literally pivoting the practice philosophy. And I've been done it overtly or stated that I'm doing this in writing somewhere. It's sort of been slowly evolving over time. And it's brought in more people who want to be that way. I think you don't need to have a massive infrastructure. I am very lucky in that I have lots of experts around me that I can refer to, but these are not formal partnerships. It's not a big institute that I have. I think it's going to evolve into potentially things like that. But the more formal it is, sometimes the harder it is, first of all, to get the rocket ship off the ground. And so I've just been slowly, consistently over a long period of time, trying to treat everybody like I want myself treated. Tammy, that's the other part about this, is that you and I know as doctors that slowly things kind of go like this, right? And I've been, for myself, trying to decrease the slope of the decline. So overall this time frame, I've been my own vitality patient, if you want, or patient zero, in trying out a lot of these things on myself and realizing, yes, you are going to go downhill. Okay, but you are going to go down slower if you optimize some of the parameters that are under your control. And I've had to read a lot more about psychology because I did a little bit, obviously, in undergrad and maybe a little bit of psychiatry in medical school. But this concept of agency is something I didn't really understand until the last couple of years. And no matter what your situation, I think Viktor Frankl's book changed it for me, is, Man's Search for Meaning. He had pretty much zero agency except for what was in his brain. And he changed his purpose in life to helping other people survive the horrors of the Holocaust. And he would go in his mind when other things were going on and try to transport himself out of this horrific situation. And he somehow had the faith or the vision or whatever you want to call it to realize he was going to survive and that he would be able to later help people by what he went through. So he helped me realize that no matter how bad it is, you can still have some tiny, tiny bit of agency. So when you start with that story and you say, oh, I can't exercise 15 minutes a day. Well, that's kind of nonsense because everybody's wasted. This is the other part. I start my classes and a lot of things with, you asked me sort of the three things. Maybe I'll give you the first one. And we've been sort of dancing all the way around this. That is, my first suggestion is for everybody to realize is that vitality is a skill. It's not a skill that I can give you, you can give somebody. It's a skill you develop by understanding what your weaknesses are, whatever they are, and start to work on them, and also polishing up your strengths. And then over time, betting on yourself to becoming a better version of who you are tomorrow, whatever that is. So the nanosecond you bet on yourself, and it sounds kind of hokey, But if anybody's listening to this and they want one takeaway, vitality is a skill is part of it, but betting on yourself is maybe this corollary to that first one, where when you bet on yourself, instantly you become more confident, but you also become more responsible. Okay. And then you have to say, okay, what do I want to do? This is where the time comes in. Is the next thing is trying to say, okay, I don't have time. I'm too busy. So the second one is to think with time in mind. And the thing that I try to teach people is all of us can be insanely busy, but a lot of it could be nonsense. A lot of it could be just giving away our attention and our awareness to things that don't matter. Whatever that alert is on your phone, whatever that screaming and yelling is that's on the TV that you're not going to be able to change, or maybe you're just awash in your own sense of importance or self-pity or whatever, is get out of that a little bit. And then I think everybody wastes 1,000 seconds. Okay. And that's about 17 minutes. So you can spend that 1,000 seconds or 17 minutes. And here's what I suggest for people and people who followed Vitality Explorers or the Vitality Explorer Substack site, and you can listen to this on the podcast. I've talked about something called the 1,000,000-second challenge. Now, I started off actually with the 1,000,000,000-second challenge, which is when I turned a certain age, I looked it up on the Social Security website, and I was like, oh, I only have about 34 years left to live based on Social Security estimates. And when I did the math on that, that was about 1,000,000,000 seconds. And I said, well, I don't want to waste any single second left. And then when I started working it back downward, 1,000,000 seconds is about 12 days. We have a lot of difficulty working past a month or two into the future, but we can think 12 days into the future. And then what I brought one. I have a little card that says 1,000,000-second challenge. It's about the size of a credit card, and it has 3 little things on it, which is 1, 2, 3. So take your to-do list. This is the mechanics of the 1,000,000-second challenge. And then you have to take it down to the top 10. And then you have to reorder that top 10 to what could I do in the next 12 days that's on that list? Rank order the top 3, okay? Only the top 3. And then it doesn't say to-do list, it says to-done list. And I've been practicing this for a little while. So I'm not going to do this in 12 days. I will have done it. And the words matter. So when you accept the 1,000,000-second challenge, you bet on yourself, and you write those 3 things down, then you start to work backwards in time. 12 days from now would be the time frame when you have to have it done. What do you have to do to get those 3 things done? Whatever they are, lose 2 pounds, finish a chapter in a book that you're going to read or write or whatever you're going to do. But if you physically write it down and you commit to yourself, you look yourself, this is actually what I say to myself and my patients. By the way, this is a lot of dog food that I eat and re-eat. I do 1,000,000-second challenges for myself 5 or 6 times a year. It really helps sharpen what I need to do in a time frame, because sometimes we just leak it out to too much time. So again, the first one is vitality as a skill and to bet on yourself. The second one is to think with time in mind, and maybe it's sort of a concept plus an action item, the 1,000,000-second challenge. And the third one, and I know you know this, but this is why we're doing this today, is that cultivate closeness. Now, we as doctors really don't, I mean, at least orthopedic surgeons, maybe you do, but orthopedic surgeons don't understand how valuable that is. And then the medical literature is replete with lots and lots of evidence about how closeness counts. So I can go into more of that, but what do you think about these total 3 or questions you have about those?
I think they're fantastic. They're actionable. I love breaking things down instead of just saying within 6 months, I'm going to speak Spanish fluently. It's what am I going to do in the next 12 days? And I've been at a conference where you handed out the cards, and they are so actionable. They're so doable. And yeah, I like it so far. I think that people like bite-sized many things to do, and they like that they have agency. They like that they have the power to do this. It's not that everything's being done unto me. And oftentimes when you have a medical diagnosis, it's done unto me. They're going to do this. They're going to do this. They're going to do this. But guess what? I choose this. I'm going to choose that. And it's so empowering. So thank you for those 3.
Right. So the third one, the action item on that, there's how do you cultivate closeness? Okay. So we know it's especially true in the cancer literature. They call it the mouse in the middle. Have you heard of this study where each group of mice, unfortunately, you don't want to be a mouse in this thing, but the mouse in the middle is the one that has the cancer, but a whole bunch of mice around it that don't have cancer. And then the other one is isolated in its cage. Okay? And what they found profound differences, same cancer, same treatment, but the one that had more mice around it lived like almost 40% longer. Crazy good stuff. And the oncologists and other people that you see, if they know that somebody's coming to their infusions or know that they're coming to their appointments, they already know that they're going to do better. So when you look at the vitality parameters that you and I know as people who inject certain fluids into bodies, is that we want some of these inflammatory markers to go down. But guess what? If you are closer with somebody, if you have 3 or 4 friends that you can actually speak to if you have a problem, or you can listen to if they have a problem, your inflammatory markers are going to go down. And so if you listen to me talk to somebody about knee pain or shoulder pain or elbow pain or any sort of pain, and I know who I'm talking to because you're smarter than I am about this, but the holistic approach to that needs to include things that are associated with decreasing sort of your sympathetic nervous overload, decreasing your systemic inflammatory markers. And it's not all about whatever formulation of PRP or bone marrow or fat you're injecting into somebody's knee. If you can connect with other people, and this is where joy comes in. So sort of it's cultivate closeness and joy is the third one. And the joy comes from spending time with people you love. That's your friends, your family, your coworkers. Just do something fun. That requires a heck of a lot of effort. We don't have to be told to do this in middle school or high school or college because we are surrounded by our peers. Have tons and tons of social interactive opportunities, whether through sports or through extracurricular activities, or just being part of a college. You maybe go to a basketball game, whatever you're doing. But as you move forward in life, especially after a certain age, maybe kids are out of the house, there's no connection to the school anymore. Sometimes you lose a spouse through divorce or death. You get more isolated. And there's an epidemic of loneliness. There's an epidemic of isolation. And we as people who take care of the musculoskeletal system need to realize that if that person is living alone and their husband died of Alzheimer's last year, or their wife died of cancer, and they're sitting there with moderate knee osteoarthritis, that's affected their inflammatory status. And I'm going to get kicked out of the American Academy of Orthopedic Surgery. But the bottom line is we should be doing a holistic approach to it. By the way, if we look at it selfishly, it's like cheating. If I stack the deck in favor of optimizing that person for their physical, mental, social, and spiritual well-being, they're going to do better with whatever procedure we do. And it's staggeringly important to think about this in a holistic perspective. And I'm not somebody who's done this my entire career. I think I've been slowly creeping up on it over the last 6 or 7 years, and certainly over the last 2 or 3 years, I'm all in.
I'm glad you're all in. I mean, as a DO, that was kind of part of the whole medical school thing. And it's amazing to see MD colleagues who kind of come around in this aspect of it. You brought up a huge point, and I wanted to emphasize isolation. What about that patient whose spouse has died? What if they're not living within a community, such as a community center? They don't have a lot, particularly say in the winter, to go walking with somebody because of the weather of where they live. What are your suggestions for these patients so that they do get community? What kind of things do you personally suggest?
It's a very tough one that honestly, Tam, it's unsolved. There's no perfect answer to that because sometimes people can be reluctant or afraid to reach out. I think technology helps a little bit, but there are evolving pieces of technology that are in development that are trying to connect people, as the kids like to say, IRL, in real life. So I try to pull out of them, what did they used to like to do? Did they like to dance? Did they like to do some yoga? Did they like to do they're part of a book club? What do they used to enjoy? And then push them a little bit to say, hey, are you going to call a friend, have a cup of coffee? Are you going to go to that book signing? Are you going to do this? If there's anybody that comes with them, obviously I try to help them say, do this. But I think you have to push people with data. I maybe beat people up too much with data, but I think it's important to acknowledge that there's an epidemic of loneliness, discuss how it affects your physicality. It's not a joke. It's the number one thing. Like, I know you know this data, but I think for the people listening, it's important to realize that loneliness is worse than obesity or smoking. There's a lot of different loneliness categories or way to do that, or disconnected, but we don't treat it like an epidemic. We don't treat it like it's something that's modifiable. That's the other part. I think it's easier to modify than those other two. I think smoking's been better, but it's not great. There's still people out there smoking who shouldn't. Obesity is obviously, pun intended, a massive, almost intractable problem. It's getting better to some degree, but maybe at a cost that's incredibly high with the medications, or maybe long-term side effects. We're not sure. But I think we as doctors need to bring up loneliness. And I do. And I'm sort of the Pied Piper of this. Tammy, I can't even keep up with, and I'm giving talks in Palo Alto on Saturday and Atherton/Menlo Park tomorrow for communities, older communities that are going to hear a lot of what you're listening to right now. And I'm going to did it last week or 2 weeks ago. So there's this huge tsunami of interest in trying to understand how to lead your longest, most vital life. I don't want to live to 100 and be miserable for my last 20 years. I want to lead my most vital life for as long as I can. And I don't think that is at all possible without close human connection.
Completely agree. One of the strategies that you've mentioned on Vitality Explorers is talking about just reaching out. Can you kind of explain to people the things where you even just like send a text message, those kind of things? What's your trick there?
Yeah. So again, I'm an orthopedic surgeon, so I like to fix things. So whenever I have something like, okay, here's my action item in a live event, what I'll do is I'll say, and I do like math too. So I'll say, here's a 100-second challenge. And people go, all right, I want you to pull out your phone and I want you to go to your messaging app. You're letting me practice for tomorrow, Saturday.
Thank you.
So what I'll do is I'll say, listen, pull out your phone. I'm like, really? In the middle of the talk? Yeah, pull out your phone. And I call it the 99-second challenge. I want you to, you can do this, anybody push pause. And if you're listening to this or watching it, push pause. And then I want you to text 3 people, okay? And just say hello. Just say you're thinking of them. Don't ask for a favor. Don't try to repair a massive gulf in a relationship. But text 3 people and say, hello, I'm thinking about you. That could be somebody from a month ago. It could be somebody you haven't seen since college or 10, 15 years ago, whatever it is. But you just say, hello, Susie, or hello, John, I'm thinking about you. Hope you're having a good day. Now, what happens when you send those out into the ether, it's going to land on somebody's phone, and maybe it's going to land on somebody's phone who really needed to hear from a friend. And guess what? It's a little selfish because you're going to get the kickback. Now, maybe not immediately. And then what I've done when I post this on Vitality Explorers or the Vitality Explorer Substack site or as part of the podcast, I'm like, okay, just suggest that they do the same. I'm actually trying to get this 99-second challenge to go viral. So if somebody's listening to this, put hashtag 99-second challenge or dare to be vital with it and say, it's almost a zero cost way of connecting with people. And you don't have to be in the same city, the same state, or even the same country. But if you do that once or twice a week, you're going to start to develop those relationships. Then you set it up and say, let's go have coffee sometime. Let's have a meal sometime. Let me listen to you. And you don't know, maybe you're going to be the person that person really needs to pick up the phone and say, hey, listen, I just lost my sister. I just had a terrible thing happen to my son. I really needed to talk to you. Thank you so much. Or the second concept, Tammy, which you may or may not have heard me talk about it, that is to develop your vitality squad, which is somebody physical, mental, social, and spiritual. And the data is off the chart. It's not a unique idea I've had. It's just that this idea of this wheel of all of them are interconnected. So if you are not somebody who wants to go to the gym, become friends with somebody who will take you to the gym. If you happen to be a super introvert who just likes to stare at a book and doesn't want to interact with anybody else, be friends with a social butterfly and go out once a month. Okay. You don't have to destroy yourself, but once a month, go out and connect with other people. The same thing goes for if you have somebody who's just mentally incredibly resilient. Like I have a friend, Captain Tom Chaby's a former commander of Navy SEAL Team 5. He is mentally as tough as I've ever seen it. So he has helped me become even more mentally tough. I think I'm reasonably good, but he's just leveled me up. And the final one, which again, we don't talk about as much as we should, but your spirituality matters. Okay. Now, I believe in God. I'm a Christian, but I don't tell people what to believe. But I do understand very well, not based on religious principles, but if you do not believe in something bigger than yourself, if you are not leading your life in service of a higher cause, again, it doesn't have to be religious. It could be something where you're giving back to your community, your country, or even just taking care of a sick child or a sick set of parents. Whatever you're doing in service of others helps your vitality, period, full stop, drop the mic. And so I've practiced in Silicon Valley for almost my entire career, and I've taken care of some very important people, just ask them. But I've tried to teach them that the idea of service to others is actually sort of selfish. And so what you and I are doing right now, obviously we enjoy doing, we take care of our patients. I feel very blessed to be able to do what I really enjoy doing and have been doing for a long time. But I try to do that in the service of my patients, my family, my community. And I'm very delighted to be doing that also in the context of teaching the next generation of physicians, which is coming up soon.
So that leads us to the courses that you're doing. And I know that you've got one that is coming up and other courses have filled like that and waitlisted. What is the very next thing other than the thing tomorrow and the thing on Saturday? What's coming up that somebody might be able to join you with?
Well, I hope to be able to. In fact, I will probably do it in the fall, but I taught the first ever vitality course for future doctors at the University of Michigan last year. And we did sort of a 10-week curriculum on how to level up their vitality based on my Dare to Be Vital book. And the results were actually quite fantastic. And that has led to me being able to teach a course called Vitality and Performance Optimization, 8 weeks to awesome at Stanford Medical School starting April 1st. So it's right around the corner. And what I'm going to be doing is working with future physicians and other Stanford students. We get taught how to take care of other people when we're in medical school, but one of my long-term goals is to be able to help future physicians and providers learn how to take care of themselves so they can better take care of their own patients. And it's open Trojan horse. So everybody knows what I'm doing is that if I can help teach future physicians or existing physicians how to take better care of themselves, then they're going to be better at passing sort of, if you will, sort of the gospel onto their patients. So you and I are sort of singing the same tune here, right? Okay. But there's a lot of people who aren't taking care of themselves or thinking that they have to sacrifice their entire lives in the service of their patients. I want to make sure that the next generation, and I've been absolutely empowered. I'm very delighted by the people I've been working with at both schools to do this. They've looked at this curriculum, it's been vetted, and I hope to be able to bring it to a broader audience, probably not till the fall, but they're on the Vitality Explorer Substack site. There's a link to the waitlist for this. And the courses that I've taught both at Michigan and Stanford have people right now emailing me saying, how can I get in? So I'm hoping that I can bring this to a much wider audience. It will be at future medical meetings, by the way. We're doing a little bit at the Toby meeting. I'm doing a little bit at the Biologic Association meeting in May. Sort of this dual thing is coming out, but I hope to have it for a broader audience later in the year.
I thank you for the public. I thank you for all the people that then were going to be helped by this tsunami of people that, you know how it goes with the whole curve that goes like this. The more people that are involved, the more lives that we can touch. So thank you so much. Is there anything that I've left out? Anything that I do need to regroup on?
I think just try to remember the three things, okay? Number one, vitality is a skill and to bet on yourself. Number two is to think with time in mind and take that 1,000,000-second challenge. And the number three thing is to cultivate closeness and joy. And just enjoy. We don't know when our last best day will be. So if we do all three of those things, I think it's right now, and it's changing. That's why I call it Vitality Explorers, by the way, Tammy. I will forever be on it. I'm glad you've been on that beach, okay? On 4 Mile Beach. Somebody look it up, or we should put a picture of it. I've got some pictures. It's a very inspiring thing. If you just close your eyes, it doesn't have to be the 4 Mile Beach, but a time in your life where you had some real sense of peace and you want to replicate that. You want to have some clarity about how you want to spend your life. That's the first step. And then to build on that over time. And then my goal again is to optimize vitality and performance one person at a time. So if just one person listening to this, one person watching this has had their vitality leveled up, we will have done our jobs. And more of this needs to occur where people like you and I collaborate. I know a lot of the great work that you're doing, and more people together can help each other optimize practices so that we can optimize ourselves and our patients.
Thank you so much. I think this is perfect. For those of you who are driving and can't take any of this down, everything will be in the show notes with regard to how to get in contact, how to follow on the Instagram, Twitter, or X, and the Substack, as well as Vitality Explorers podcast. Dr. Allan Mishra, you have been an absolute joy to work with, and I look forward to future collaborations. Thank you so much.
Tammy, thank you so much for having me as a guest, and I look forward to collaborating personally and professionally. Take care. Have a great rest of your day, everybody. Oh, and by the way, I always like to finish with this: dare to be vital.
Dare to be vital. Thank you. If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.